was to be presented by the CEO, Ms. Mushrafa Hussain, GD Hospital, CEO, GD Hospital and Diabetes Institute.
That's why the service that they have received from us.
But because of her professional engagement, she's not present amongst us. But she has sent her best wishes and a video that will be played now.
That they have received from us. Department, GD has been very proud of its team and now we are venturing into the area of laser surgeries to make it more comprehensive and hopefully serve people in a much more better way. So other than this, there are so many more things. I mean, healthcare is something that definitely has very few limits. And like I said before, we dream big. So definitely in our pipeline, we envisage a cath lab and nephrology unit with facilities for acutely, terminally ill people. And we hope to see that very soon. First baby, but I could say that it has also been like a parent for me because it has been my first workplace. So my initiation into the world of professionalism, learning, knowing, everything starts from there. So it has been a wonderful, mutually contributing relationship where I have given, but I have got and received a lot more. In these last 14 years, I have seen the hospital grow. I have seen me grow with it. I have seen our own team grow in leaps and bounds. Today we stand at a juncture where GD dreams big and we are at par with all our peers in this city. We have achieved recognition not only in this city but also in India. I'm very proud to announce in this context that we now are equipped with not only a state-of-the-art gastrology department but one that also includes bariatric surgeries and bariatric procedures which form a very important part of diabetic care. That has been not only growing in terms of technology but also in terms of the results that we are now getting. And more and more we now focus on arthroscopy, so minimally invasive surgeries that help people to recover much faster and definitely improve the quality of life for most of the patients. And I can say there that most of our patients have been very satisfied.
Hospital and Diabetes Institute, who is present on behalf of Ms. Mushrafa Hussain. Devnath is currently the founding Dean of the School of Computing and Information Technology at Eastern International University, Vietnam, where he joined in 2018. He is also serving as the head of the Department of Software Engineering at Eastern International University, Vietnam. Formerly, Dr. Devnath served as a full professor of computer science at Winona State University, Minnesota, USA for 28 years, and as the elected chairperson of the Computer Science Department at Winona State University for 7 years. Dr. Devnath has been the director of the International Society for Computers and the Applications USA since 2014 and also served as the ISCA president for 2 separate terms from 2005 to 2007 and from 2011 to 2013. Professor Devnath had received his Doctor of Science degree in Computer Science and also the Doctor of Philosophy degree in Physics. He made significant contributions in teaching, research and services across academic and professional communities. He has made original research contributions in software engineering, artificial intelligence and applications, and information science, technology and engineering. Dr. Devnath is an author and co-author of over 500 research paper publications in numerous refereed journals and conference proceedings in computer science, information technologies, system sciences, mathematics, and electrical engineering. He is also an author of over 15 books. Professor Devnath has made numerous teaching research, and has been invited as abroad as keynote presenter in various international conferences, industries, and teaching and research institutions. He has been maintaining an active research and professional collaboration with many universities, faculty, scholars, professionals, and practitioners across the globe. Professor Devnath is going to give us the John McCarthy Memorial Lecture, and the title of his keynote speech is Recent Technological Advances in Health Science and Some Challenges.
Good afternoon. I think we are back to normal. Now I see that, as a teacher, the first thing we notice in the classroom, who is listening, who is not listening. And I see many of you since this morning looking at your cell phone. But take this opportunity to listen something so that at least you have some information. This topic is very different than what we had in the morning. This relates to technology. And as you can see, I am not in healthcare profession. And so the topic will be slightly different, but I think you may like some of these, but I will focus as much as I can on healthcare. This is John McCarthy Memorial Lecture. And so let me talk a few minutes on John McCarthy. He's the founder of AI, artificial intelligence, and developed a programming language called Lisp. Born in 1927 and until 2011. American computer scientist and cognitive scientist. Received a Turing Award, which is our highest award, among many others. And he was mostly spent time on Stanford University, MIT, Dartmouth College, and finally in Princeton University. So let me say where I am from. As you heard, I was in the United States for more than 40 years. Recently came to Vietnam to build a school of computing and information technology. And I was actually in the state of Minnesota, where you see the southeast corner of the state. Now let me quickly go through some of the interesting weather in Minnesota. This is the Minnesota spring. Nice looking weather. This is summer. This is a part of the university that I was. This is beautiful fall. All the leaves turn color. And on the backside is the Mississippi River, which is a well-known river that we know. And finally, this is the winter. A lot of snow. In Minnesota, the winter dominates. So we have lots of snow, lots of winter, and it stays long time. I am now here in Vietnam, close to Ho Chi Minh City, which was Saigon before. And this is the main gate of the university. It's called Eastern International University. And if you know someone in computer science, information technology, who is about to finish PhD or just finished PhD, give my contact information so they can contact me, and I want to give opportunities for teaching positions in my school. So keep that in mind, because although I spent long time in the United States, but I still want to help my home country. And so as long as you have friends, relatives who needs a university academic position, please give my contact information to them, and so that they can contact. Okay, and I would like to give them opportunity for international experience. Okay, so this keynote exactly focus on two things: what we already know, which shows the current progress, and what we do not know, which gives you the challenges and opportunities. So what we really want, everything smart. Smartphone, smart car, smart house. Smart aircraft, smart warehouse, everything smart. Simply speaking, we want intelligent device and applications which completely depend on intelligent software. So although most of you are in healthcare profession, remember that everything that we get depends on software applications, which relates to information technology. And that is why this conference added the health science and technology. So if you say, how do we achieve what we want? Everything smart, everything intelligent. Everyone will say artificial intelligence or AI. So let me give you a few obvious regular applications of AI, and then we will focus mostly on healthcare as much as I can. So this is AI. If you look at this, AI is a broad area. The subset of AI is machine learning, and the subset of machine learning is called deep learning. All the applications, most of the applications that we have today is on AI along with machine learning and deep learning. And I'll give some examples. So it says that AI alone or in combination with machine learning, deep learning, computer vision, and blockchain helps software development industries in general and medical and biomedical industries in particular to build intelligent software in a wide range of applications. And actually, the AI is growing on every single day. For example, in education, we have creating smart content, which is digitization. Voice assistants to improve students' learning. Then in e-commerce, you have AI-powered assistants using natural language processing and fraud prevention. In human resources, we have hiring process with intelligent software, and in the United States, we use quite a bit nowadays. In navigation, we have GPS, improve operational efficiency. In agriculture, AI, along with computer vision, robotics, and machine learning, we can improve food production and improve farming. In lifestyle, we have automotive, electric and autonomous vehicle. We have facial recognition and recommender system. In automobiles, we have self-driving vehicles, emergency braking, blind spot monitoring, driver assist steering using intelligent sensors and powerful cameras. In gaming and sports, we can predict human behavior using which game design and testing can be improved. And you probably heard 11 years ago, we had man versus machine. IBM Watson supercomputer wins $1 million in a Jeopardy game, which you probably see in the TV. At that time, experts called this a technological breakthrough. So we have intelligent transportation system, which is an advanced application which aims to provide innovative services relating to different modes of transport and traffic management and enable users to be better informed and make safer, more coordinated and smarter use of transport network. Finally, intelligent medical systems. It helps to improve the quality of interventional healthcare in a data-driven manner using principles and knowledge from a diversity of research fields, including AI, statistics, computer vision, biophotonics, and medicine. So these are all applications related to AI. In robotics, simple application, carrying goods in hospitals, factories, and warehouses. And then you have human-robot communications, a robot in manufacturing industry, agriculture industry, mining industry, and of course in healthcare. In healthcare and medicine, AI and machine learning together has tremendous applications. We have sophisticated machines that can accurately detect diseases and identify cancer cells. Increases clinical efficiency, boosts diagnosis speed and accuracy, improves patients' outcomes. We use historical data and medical intelligence for discovery of new drugs. And the last one, which you see, in a normal situation for many years, bringing a vaccine out takes many, many years. However, because of application of AI, advanced research, the COVID-19 vaccine came in exactly 18 months. That helps the whole world to recover. And so we know that AI has a significant contribution towards advanced medical and health care tools and devices. Finally, healthcare and medicine. AI computer systems are used extensively in medical sciences, and such a use is rapidly expanding in recent days. Common applications include diagnosing patients, end-to-end drug discovery and development, improving communications between physicians and patients, transcribing medical documents such as prescriptions and remotely treating patients. While computer systems often execute tasks more efficiently than humans, more recently, state-of-the-art computer algorithms have achieved accuracies which are highly comparable to human experts in the field of medical sciences. These are some of the vital role of AI in healthcare, and there are many applications that you see directly relates to health sciences. But let me focus on 5 important areas, 5 top real-world examples. So this includes robotic surgeries, virtual nursing assistants, precision medicine, chatbots, and administrative workflow assistance. So these are the top of examples that we can see in health sciences. So AI has the power to increase primary care. Chatbots offer immediate conversational responses, and connecting becomes quite simple for patients. When executed effectively, chatbots can even help healthcare providers to exceed patients' expectations while improving patients' outcomes. AI enables smooth flow and automation of primary care, and that is quite important to save money, particularly in the US. Robotic surgery, AI technology in the form of collaborative robots, has brought about a revolution in the field of surgery in terms of their speed and depth when making the fine incision. Generally, the results of surgery, especially a new and complex process, can change with surgeon's skills. However, AI machines are very precise, and they mitigate the probability of only accidental movements during surgery. So this is a big advantage for surgical applications. Virtual nursing assistants, which is available 24/7. From interacting with patients to directing them to the most effective and best care setting, virtual nursing assistants could save $20 billion every year for healthcare industry. They can monitor patients, answer their questions, and hence offer quick answers in real time. Today, most of the applications of virtual nursing assistants enable regular and consistent communications between healthcare providers and patients, resulting in fewer chances of unnecessary hospital visits. Very important applications. Precision medicine is known to be one of the most valuable examples of AI in healthcare. It depends on the large amounts of data gathered from several disruptive technological innovations, such as chip genome sequencing, advanced biotechnology, and health sensors used by patients at home. Remember, precision medicine depends on advanced supercomputing algorithms with deep learning, and it uses the cognitive abilities of physicians at a new scale. Finally, administrative workflow assistance, that it guarantees that care providers gives priority to urgent tasks, helping doctors, assistants, and nurses save time on their normal jobs. Applications of AI in healthcare could lead to about $18 billion savings for the healthcare industry. Technology like voice-to-text transcription offers help on administrative end of healthcare. This helps automate non-patient care activities. So these are some of the normal and very advanced applications that we see in recent days. Major benefits. AI really made a major impact in healthcare. With AI, spending in the healthcare and pharmaceutical industries is expected to increase from 463 million in 2019 to over 2 billion in 2024 or 25. The global AI in the healthcare market size is anticipated to grow from 4.9 billion in 2020 to 45 billion in 2026. The use of AI in the healthcare industry is radically changing the face of information technology, and this is where we belong. We are interested that how can we help, how information technology advances can help healthcare industries. This spectacular growth stresses the need for healthcare institutions to embrace artificial intelligence to offer cutting-edge healthcare solutions to their customers. So you can see that AI plays a significant role in our health sciences. We have an AI lab in the Eastern International University, and we have some projects. One is how to detect traffic violation, how social distancing alone can work, and finally, skin disease detection. We have an algorithm and a tool that if you have some kind of skin disease, you can identify very quickly whether it's serious or not serious. And we have, there are so many skin diseases can happen. So, also more interestingly, skin disease, most of the skin disease or major skin disease happens in Australia, United States and Europe. And so Asia is not one of them. However, my new project is to find out what is typical in Asia and what is typical in South America. They do not have a major impact of skin disease. So this is some of the algorithms that we have. And finally, this is the lab. So these are some of the projects that we have been doing in medical area as well in my AI lab. Now is this future super intelligent AI. This is very interesting. Few days ago, in fact, few months ago, it was in the TV, CNN. The topic was untold story. What happened in a hospital in Denmark? They collected thousands of brains with psychiatric illness and stored in brain research on psychiatric evaluation and psychiatric care. This is a huge resource that will come in the future. And these brains are quite different from normal brains. So what happens, in order to study so many thousands of brains to help psychiatric illness, we might need a very effective supercomputer as well as intelligent software systems. So we need both of them. And researchers believe that such an advanced study may help improve patients with dementia, Alzheimer's, Parkinson, and other brain-related issues in the future. So this is a challenge, and this will be coming in the future, and that is because of revolution of AI. Next, another one you will see in the future, which is the major applications of AI, is smart technology that includes how to create a soft robot, not a hard robot anymore, whose shapes and sizes can change. That will make it very flexible applications. How to make human milk new mothers can use replacing breastfeeding. So these are the applications you will have. Sleeping Smart, a small device which can help sleeping disorder. Electric boats, which avoids pollution altogether following Tesla car technology. And then finally operating with holograms. This is a major application that hologram technology will make a revolution for patients with serious complications after surgery leading to a potential death. It appears that about 15% of the people after surgery, major surgery, dies. The question is, how can we improve? That's the idea. So, you will see that future super AI with supercomputer, super intelligent software has a big prospects in the future. So, AI and machine learning applications to automobiles, to railways, to aviation, to healthcare industries are helping to significantly improve reliability, services, safety and protection to human life and human lifestyle. Now comes the problem. So everything that I discussed so far, we already know. Everybody is happy. But society is now divided in two ways. Number one, we have computer users versus computer scientists. We are all users, but a small subset is computer scientists. So computer scientists, software engineers and software developers have a very different perspective. Do we really get what we really want? That's the question that we do not think. That leads to practical challenges for now as well as in the future. So, it is bad news, but it gives us an opportunity to develop further. That leads to the software reliability issue. Now I am going into a computer science and technology issue. First question is, and I'll go fairly quickly because many of you are not, maybe not interested in this. What is it? What affects it? How is it important? And can you achieve 100% reliability? Remember, for healthcare solutions, we need 100% reliability to save lives. This is an important topic for that, in that context. So, this is the software development process that we typically use. We specify what we need from a software. Then we give the outline of the solution called the design. Then we implement, which is the programming. That's called implementation. And finally we make sure that it works. That's testing. And finally we can constantly maintain to make sure that software does not give negative results. So, our IEEE major society defines software reliability as the probability that software will not cause a system failure. Sometimes your system doesn't work. So it says that it will not cause a system failure for a specified time under specific conditions. AT&T Bell Lab defines it slightly differently, but very similar. The probability that a given software system operates for some time period without software error on the machine for which it was designed, given that it is used within the design limit. So there is some under condition how much it can work. However, I have a different definition and a very simple definition that reliability of a software system is a measure of how well it provides services expected of it by its users. And I will specifically emphasize on medical usage or healthcare usage. And our goal, especially in healthcare, especially in medical sciences, is to achieve 100% reliability. Again, this can affect human lives. So why do we need? Well, when the requirements and dependencies on computers increase, which we do nowadays in medical science, in healthcare, industries. The possibility of crisis from computer failures also increases. The impact of this failure ranges from inconvenience, economic damages, and of course it can be loss of life. So, reliability is a major concern in the society. What are the factors that it depends on? It depends on not one or not two. It depends on 3 or 4 factors makes life complicated. Software specification, which is the accuracy of the specification. After 60 years of software engineering, we still do not know how to do accurately. Correctness of the software design, that we really can solve the complex problem with a specific design methods. Correctness of the mapping of software design to implementation. And finally, reliability of each component of software, because software is not one piece, it consists of thousands of pieces. So you need to depend on each one of them. To really depend on all the accuracy of these is not easy. That makes a limitation. So the question is, can we really achieve 100% reliability from a software system? The answer can be, yes, we can, maybe, or no, we cannot. And we'll have the answer before we leave. So the idea is, they focus on software validation. The goal of validation is to establish confidence that software should perform as intended. For example, when a doctors use a software in a hospital, they depends on IT. They must make sure that software performs adequately every time. Every time. Otherwise, that can be a problem. And there are various methods of validation, but looks to me that software testing is the most common, widely accepted method. Because it is widely accepted, because it is common, it does not imply that it is the best. It is the most effective, doesn't it? So the question is, we have a lot of work to do. So researchers have been trying to come up with efficient testing tools and techniques, but progress in this field is very slow. That gives us an opportunity to further improve. And also be careful that all our medical science, all our software that we use in healthcare really works. And here are some of the limitations. If you look at this, we can always make mistakes in the specification. That becomes a fault that goes to the next phase. In addition, we do new error in design phase. This together becomes a new fault that goes into the coding phase or implementation phase. And we make lots and lots of errors in the implementation, in the programming phase. That finally, all of these errors and faults come into the testing phase. And therefore, the sources of faults, errors, are so many that is almost impossible to correct all of them. Impossible. That gives a limitation. So what we do, we classify faults in different categories, we isolate them, finally fix them, but fixing can also be not enough. So that is a problem. Also, there are many kinds of faults, not just one or two. That makes it difficult to identify which one. Input-output faults, logic faults, computational faults, interface faults, and data faults. And of course, within each category, we have a lot of other categories. That makes it the life very complex. The second limitation, we have two things. We have specification, what the software is supposed to perform. Also, we have implementation, which does exactly what it's supposed to be. It appears that in most cases, the two set does not intersect. If we really know how to develop a software, these two circles should be one. But we don't have. In fact, the intersection is very small, and we don't know how to improve or how to enlarge. But the idea is to make sure that the set S and set P intersects as much as possible. Next limitation. When you do testing, you basically use test cases or test data. Now you have 3 circles, makes life very complex. Now if you look at this, only region which is most important is region number 1. That means software is specified, implemented and tested. That's the only region. But if you look at this, the area is very small. Idea is advanced research in testing, how to make that area big and bigger. And there are 2 fundamental approaches, functional testing and structural testing. Functional testing creates difficulties in terms of gaps and redundancy. So all the methods that we have so far cannot identify all the cases that output we want. At the same time, there might be the method which gives lots of test cases, has lot of redundant data. That doesn't help. So these problems can be reduced or eliminated in some cases by developing sophisticated methods. And so this is another opportunity we have. Structural testing creates difficulties in many difficult situations. Number 1, potentially infinite number of paths that we cannot test. Infeasible paths that data cannot reach, that another problem. And then there are other phenomena like coincidental correctness, missing paths. And now it says these problems are impossible to solve. So you can see that when we use medical software, we have to be sensitive enough to make sure that the software really performs what is intended. And that's why we need 100% reliability, or at least close to 100%. Finally, we have a lot of different levels of specification, design, and then we have 3 kinds of testing level. Unit testing, integration testing, system testing. Last 60 years, we have done some work on unit testing, very little integration testing, and almost none in system testing. Makes the field really less developed than we expect it to be. So, should we be concerned? Probably yes, because software testing, especially large and complex intelligent systems, is difficult. There is no single acceptable methods, and finally, 100% testing is impossible. Should we be encouraged by this? The idea is, of course, yes, because most of the theory of software testing has been proposed in only limited areas, and we can expand much more with a lot of new programming paradigms, and therefore it is important to develop testing theory for other new programming languages and paradigms. Final observations. Can we achieve 100% reliability for a large and complex intelligent software systems? And because of so many limitations that I just described, the answer is absolutely not. In general, it is impossible to get 100% reliability, and therefore, only goal we can have is to how to improve, how to maximize, depending on the resources we have. Now, one time, IBM came, remember that all these complex software systems that I am referring to, IBM, Microsoft, Amazon, all these industries are involved in order to create effective robots, in order to come up with effective drugs. Everything is both medical science and information technology together. And AI is a part of that. So that's number 1. One time, you probably heard, we have a very famous clinic, Mayo Clinic, in Rochester, Minnesota. And one time, a doctor who has MS, MD, PhD, took the class. And I was surprised. Why a doctor is taking software engineering class, software testing class? And after the class, I asked him, why are you taking this class? He said, because we use these softwares, we need to develop an automated tool so that it can automatically help us how to test. So he is taking the course to know the theory in order to build a software tool which is directly useful for his medical research. So you know that AI has major impact. So here are the concluding comments. The field of software testing is wide open, leading to many new challenges and exciting opportunities in the field of computational intelligence and innovative applications. And healthcare industry is a major industry that we need to address. Next, through active national and international research and professional collaborations between academics, healthcare industry, and IT industry. When you say academics, it's medical science. Healthcare industry and IT industry together can make a significant advances in health and medical sciences in the near future. And finally, as I mentioned few examples, super intelligent AI, which is yet to come, at least next 7 to 10 years. There are 3 levels of AI. We are in the first and second level. Then we finish second level, then we go to the third level, which is super intelligent AI or super AI. In the context of humanity is yet to come in the distant future. Thank you very much. Enjoy the conference.
All right. Thank you, sir. Now I request Professor Niloy Sarkar, sir, to please come up on stage and felicitate Imin and guest.